My name's Dr. Danile. I'm a radiologist specializing in breast imaging and interventions at Charlotte Radiology. So I'm going to explain how an ultrasound-guided breast biopsy is done. First, we cleanse your skin with a topical antiseptic like betadine. Then we numb your skin with a needle using a local anesthetic, similar to what a dentist would use. After your skin and your tissue is numb, we place a little nick in your skin, and through that nick, the biopsy needle is placed. We use the ultrasound machine to guide the needle to the targeted area that we're going to biopsy. Generally, about 2 to 5 biopsies are taken, or samples of tissue. After the last sample is taken, most of the time we'll deploy a little tiny marking clip in the breast, and then following the procedure, we will get a couple mammogram pictures. The risks are minimal and they include bleeding and infection. We do not anticipate having either of those complications. There are minimal preparations for this procedure. If you are taking any medications that thin your blood, we ask that you hold those for 5 days prior to the biopsy. A radiologist specializing in breast imaging and procedures will be performing your biopsy. The actual biopsy takes probably less than 10 minutes, but you should expect to be at our office for up to an hour. The rest of that time is used for registering, changing into a gown, answering your questions you might have prior to the biopsy, and then the post-biopsy care and reviewing your discharge instructions. Some patients experience very minor discomfort during or following the procedure. Most of that is due to the local anesthetic that stings and burns for a few seconds before numbing the tissue. There are no stitches needed for the procedure. The skin nick is so small that we cover it with some small steri strips, and those will fall off on their own within 5 days. The results are generally available from pathology within 2 to 3 business days. A staff member or radiologist will call you with the results. If you have any questions, though, a radiologist is always available to talk to you. Thank you for choosing Charlotte Radiology and Levine Cancer Institute.